front line, particularly at the hospital. We've got Dr. Chris Colbert. He works at the University of Illinois Chicago Hospital. And because May is Mental Health Awareness Month, we have to talk about the toll that coronavirus and this entire situation is taking on our healthcare workers, the frontline workers, all the staff, all the employees, doctors, nurses that are at the hospital. So we've got Dr. Chris Colbert here with us to talk a little bit more about that and what the front line is actually dealing with kind of behind the scenes. Dr. Colbert?
Hey, yes, how are you doing? Good morning.
Good morning, and thank you for being with us. Can you paint the picture? What's the situation like? Because it's kind of behind the scenes of the front line.
Sure. That's what we're seeing specifically in the context of coronavirus. We're seeing a higher volume of sick patients, and this quite naturally take an emotional toll on all healthcare providers. That includes nursing staff, that is physicians, that's EMS, that's police officers as well. And this emotional toll can build up, resulting in what is defined as second victim syndrome. And now with the second victim syndrome, in fact, you have an adverse reaction to a patient event, and that results in personal responsibility felt from the healthcare provider, which results into high anxiety as well, which makes the patient the first victim and the provider the second victim. Hence the name secondary victim syndrome.
What is being harder for them to take on right now? What they're seeing on the front lines caring for sick victims, or is it more anxiety of worrying about bringing home the disease to their own family, worrying about their own family, and how they're handling the situation? Or is it compounded?
Honestly, that's a great point, and it's both. It's both. All of that attributes to the anxiety. It's not only just seeing patients, it's seeing patients and feeling that there's a large volume and limited resources that we can sometimes offer. It's not as simple as an appendicitis where a patient can come to the emergency room and you can call a surgeon and everything is taken care of. Based on age, comorbidities, there's significant different outcomes based on coronavirus. And coupled with that, there is the honest concern of, am I bringing something home to my family?
I think, go ahead. Finish your thought, sorry.
No worries. With this exposure, do I in fact increase the risk of bringing this home? And that just builds to the anxiety as well.
I wanted to ask about, frontline workers and folks, 10 or 15 years ago, even PTSD wasn't really talked about for first responders, and now we've started having more training sessions for first responders and healthcare workers to be advised of signs that what they're going through is something to talk through. So I think we're a little bit better equipped to have this conversation. Do you feel like health care workers and people on the front lines at least are more open and the stigma is a little bit gone compared to 10, 15, 20 years ago?
Oh, yes, by definition. In fact, these concerns of anxiety and the emotional toll on all first responders has always existed. So the silver lining on this cloud is the fact that, in fact, we are expanding the conversation. There's enhanced resources for first responders on the topic of increased anxiety. So yes, in fact, we're able to have a more open discussion and offer resources for something that's always existed. And it's just, we're at a better place as a medical community to address this concern.
What kind of resources are you guys talking about?
There's three main resources. There's in-house resources, meaning that there's staff that you can communicate with. There's online resources, and coupled with that, there's, of course, there are different various numbers you can call. What we do and what most hospitals do is throughout the course of the day, as an example, in the emergency room, throughout the course of our shift, we check in with each other. It's called a huddle. And specifically at our shop, it's 7 o'clock, 11 o'clock, and 3 o'clock. We literally bring all of the staff together. That's nurses, that's techs, that's physicians. Those are some of the consults, some of the admitting physicians upstairs as well, where we all get together and have a conversation in reference to not only patient care, but how we're doing. The question is always asked, hey, you know what? This is where we communicate. This is where the peers have a conversation on how do you feel? How are you feeling with your family? How are the emotions with your patient interactions. It's kind of like a well check to ensure that we're all working in a safe, both physically and mentally safe environment.
What do you tell the family members of frontline workers to look out for? What are warning signs that something may not be right? John comes from a family of first responders. Should he be watching something in his brothers for signs that things are a little off?
Okay, great question. The biggest thing is distancing. It's distancing because most first line providers know that this is what they're supposed to do and brush off these concerns due to the need to help the community. And so it's how was your day at work? Oh, it was fine. It can't be fine every day. It just can't.
Right.
There needs to be dialogue. There needs to be a conversation. Something as simple as just engaging in conversation with any healthcare provider, honestly, has a huge role in mental welfare.
I know that we have a salute to healthcare workers today in the form of the Blue Angels flying on by. I imagine, whether it's that sign or, there's been a lot of efforts to show support in our windows and flashing our lights, banging pots and pans. I hope that message really does reach healthcare workers and make them feel a little bit better about having to go to work while a lot of us are at home and benefiting from all the hard work that they do.
All of those signs, it just resonates with us, and it just encourages us to see patients, to know that by definition we're all in this together. It's huge support. It's patients coming to the emergency room at 3 o'clock in the morning, not for medical concerns, but to drop off pizzas. That's huge. Or just the thank you cards that we get from the community, or when the paramedics just show up and they've got Giordano's pizza, or someone orders online Garrett's popcorn, something like that, something which may seem as small as it is. It's a huge show of support, and it's huge emotional support for all of first care providers.
Mm-hmm. Certainly.
Things to keep in mind, and that we should also keep in mind that we can do small things to help them do better. Definitely good to know. Doctor, thank you so much for joining us this morning. We appreciate it.
I appreciate the invitation. Thank you very much.
And there is the information on your screen if you would like some updates about COVID-19. Go to hospital.uillinois.edu.